Well, welcome viewers. Well, today we have two very special guests that will be joining me in the studio. Well, they are Professor Cumming, UK Ambassador for Health to the Overseas Territories, and Dr. Natalie Wright, Health Protection Lead and Consultant in Global Public Health from the UK Health Security Agency, where they will be speaking on a number of COVID-related subjects, such as the hot topic of vaccine boosters, vaccination among children, and some of the work they've been doing within the territory. But before we get to these questions and answers, let's first take a quick commercial break.
You value traditions.
Today.
You value music. You value education. Family.
I love you.
Service.
Thank you.
You're welcome.
Love. Life. At Popular, we're committed to you and everything our community values. For the things you value the most, count on us. Popular.
Well, welcome back, viewers. Well, as mentioned previously, we have with us Professor Cumming and Dr. Wright, who are both health experts from the United Kingdom. Well, welcome, Professor Cumming and Dr. Wright.
Good afternoon, Kamal. Thank you.
Well, we start with the hot topic of vaccine boosters. Well, it has already been reported in a number of countries in the region and obviously internationally regarding the rollout of vaccine boosters in their respective country. Now, what can you tell us about vaccine boosters?
So, hopefully the viewers are familiar with the concept of vaccine boosters because it's something that happens with many vaccines that have been around for some period of time. So, for example, people will be familiar with the tetanus vaccine, where a booster is given every 10 years or so to make sure that the body remembers what the foreign organism is that they're actually trying to fight. And the COVID booster that we're giving is just the same. So it's a way of reminding the body of what the virus that causes COVID actually looks like, to be able to help the body continue to fight it off, to continue to have the defense mechanisms in place should somebody become exposed to the particular virus. Now, with the COVID booster, it's currently being recommended that it should be given somewhere in the region of 6 months after the second dose, because the evidence is suggesting that by about 6 months is the time that your body needs that reminder of what this foreign organism actually looks like.
So you said in terms of a reminder after the first 6 months, so will this be an annual something? Persons have been asking that question, you know, after they get the booster, will they have to be continually taking the booster?
So I think the honest answer to that question is we don't know yet. Obviously, the virus that causes COVID is a very new virus. We're still learning about this all the time. So the simple answer is we don't yet know whether or not the vaccine is something that will provide ongoing protection, or if it is something that will be needed to be topped up on a regular basis. And if you look at vaccines that have been around for many years, we do have vaccines, for example, such as the yellow fever vaccine, where that's given as a single dose now, and that protects people for the whole of the rest of their life. Whereas, as I've already mentioned, the tetanus vaccine, the anti-tetanus vaccine, for example, your body does need to be reminded every 10 years or so. So as we gain more knowledge and more experience of this horrible virus and how we can best protect ourselves against it, then we'll be able to answer that question in more detail.
Okay, and also for those persons who are concerned about getting this third shot known as the booster, what advice can you provide to help address some of these concerns these persons may have?
I think the key piece of advice really is to say that, you know, the point of the vaccine for COVID is really to protect you against the infection itself. So the booster is really, you know, it's there to improve the protection that you may have from your first and second dose. So I think the key piece of advice is that, you know, it really is the best way to stop you both from getting the virus, but most importantly from becoming seriously unwell with it. Because although it happens in a minority of cases, some people do become really unwell, and unfortunately some people pass away from COVID, particularly if you're in an older age group or if you're in a clinically vulnerable group. So I think our key message really is to have the booster in order to protect yourself from the virus.
And in terms of the territory, now we come to the BVI. Now, how soon will these boosters be made available in the BVI, and what is the rollout plan?
So there are booster doses of the vaccine that are currently earmarked for BVI that are in the large storage facility in the northwest of England at the moment. To be able to get these boosters here safely and to make sure that they are fit for purpose when they're actually here, we need to ensure that the cold chain that protects the vaccine from the minute it leaves the UK to the minute it arrives here is protected. And we also need to make sure that there are ultra-cold freezers here, because the recommended vaccine for boosters is the Pfizer vaccine, which is not the vaccine that has actually been used to date in the majority of cases for people here in BVI. So the Pfizer vaccine has to be stored at a temperature between -60 and -80 degrees centigrade. So the HSA here have ordered the special ultra-low temperature freezers. They are now awaiting delivery. Hopefully they will be here in the next 4, 5, 6 weeks or so. And as soon as those freezers have arrived, have been installed and are running at temperatures of -60 at least, then we'll be able to ship the vaccine with dry ice in special shipping containers to get it here and to get it stored in those freezers. So we're hoping that very much by the end of the year we'll have the vaccine here and available to start the booster program.
And in terms of, give me a number when it comes to quantity that you have stored presently earmarked for the territory.
Well, we'll very much be guided by Dr. Ronald Georges and his team here in terms of what the numbers are that are needed. But the UK government has said repeatedly that it will provide the vaccine that is needed and the booster doses that are needed for people who want it in the territories. So there are many thousands of doses in the freezer at the moment, and obviously it's the same vaccine that's being used for all the overseas territories, plus indeed for the UK itself. So it's a huge storage capacity, but certainly in the first instance I would imagine we'd be looking at shipping somewhere in the region of 3,000 to 5,000 doses of the Pfizer vaccine.
I know you said that the booster is Pfizer, and as you did mention, the vaccine that the most that would have been procured from the UK mostly is the Astrazeneca version of the vaccine. So for a lot of persons now hearing this, they may be a little concerned on that note regarding, well, I had the Astrazeneca, is that going to affect me if I change the type of vaccine I take?
Not at all, no. There's no need to be concerned on that basis. We take our recommendations from the UK Health Security Agency, which is the agency that I work for, which has reviewed all of the evidence, and a booster with Pfizer is absolutely effective and is recommended in the UK, and is certainly what we're recommending and supplying for all of the overseas territories, including the Virgin Islands.
Okay, so let's turn the subject now to the vaccination among children. And so far we know that the Pfizer vaccine is approved for children ages 12 and above. However, we also know that the UK backs the AstraZeneca vaccine. Now, has there been any further developments in the AstraZeneca version of the vaccine for use among children?
Not that I'm aware of. The evidence is constantly under review, as Professor Cumming talked about earlier on. I think the key thing is that the Pfizer vaccine is very much what we recommend for young people. And I think while we're talking about that, it's worth saying that although we know that young people, fortunately, don't become particularly unwell with COVID for the most part, there is still a very small number of cases where children can become particularly unwell, seriously unwell, and in some rare cases, but nonetheless they do exist, they die. And so in that basis, we're really urging, the 12 to 17-year-olds to come ahead and have their shots too.
So on that note, that means then that the vaccine that would be used regarding vaccination among children would be the Pfizer, right?
That's correct.
Yes.
And so just speak about that particular, vaccine and how you guys have been going about, talking about getting more children vaccinated in the territory.
Well, I had the privilege to spend a few hours the other day with the vaccination team from the public health team here in BVI and with Dr. Ronald Georges when we talked through how the vaccine perhaps differs slightly in the way in which you make it up from the AstraZeneca vaccine that everybody's familiar with. We made sure that we talked through the handling clearly of the ultra-low temperatures, how we can go about bringing that vaccine up to room temperature in a safe way, how we safely reconstitute it, and then how we draw it up into the 6 individual doses that come in each vial. So the team are being fully trained in all aspects of that, and are literally ready to go with the vaccination program now once we have the freezers and once we have the vaccine here from the UK.
Okay, so it's safe to assume that those vaccines would be come in close proximity of when the boosters will arrive then, because we're saying that the Pfizer boosters will arrive when the territory have the mechanisms to be able to house those vaccines, those boosters here. So we're saying also too that more than likely by year end, around the same time when the boosters are scheduled to get here in the territory, obviously following that of the arrival of the freezers, is when they will have the Pfizer here in the territory to accommodate vaccination among children.
Yes, that's correct. It is the same vaccine. So the booster vaccine is exactly the same vaccine as the vaccine that will be given to 12 to 17-year-olds here in BVI. It's exactly the same, and it will obviously therefore all come out of the same supply and the same stock. I don't have a definite delivery date for the freezers to actually be here yet, but we're hearing that it's likely to be early to mid-December, and then you need a short period of time for the freezers to stabilise and to get down to ultra low temperature, and then we will ship the vaccine as soon as possible thereafter.
Okay. So now speak on some of the work you guys have been doing behind the scenes here in the territory.
That's all right.
Yep. So for my part, I'm a public health doctor by background. So I have been working with Dr. Ronald Georges predominantly. We've done a lot of work, had lots of discussions around COVID, exactly the topic of conversation that we're having here today around vaccination, but also other aspects of public health, including mental health and talking about chronic diseases and how we tackle those going forward, and how we prevent people developing them in the future. So that's been the main focus of my work here.
And on my part, one of the things that we're starting to do is perhaps as we move out of the more acute, immediate phase of COVID, that we actually start to look at what are the other aspects of health that we can work in partnership across the overseas territories and in partnership with the UK to help strengthen systems. So although not particularly an area we've focused on this trip, that would include areas such as how we can further strengthen and develop the laboratories here. I've had the privilege of several meetings with Minister Malone and indeed the Permanent Secretary in the Ministry of Health to talk about how we make sure that we have a sustainable workforce strategy for every territory so that we can train as many people locally as possible to work in the healthcare system. Because one of the things that COVID has done is it's reduced the number of people that are willing to travel overseas to work, and therefore a number of places are seeing shortages in healthcare workforce at the time they need them most. So there's a range of opportunities, a range of options being discussed to how we recruit people, how we retain people, how we offer additional training initiatives here in the Virgin Islands. But we've also been focusing on other aspects as well, including what work we could perhaps do together to prevent people from becoming unwell in the first place, and how we could perhaps help focusing a little bit on lifestyle, on diet, on exercise, to see if we can keep people fit, well and healthy and avoid them developing conditions that could lead them to having impaired health in later years.
And in terms of vaccination, I know obviously the message have been consistent regarding that need to, educate persons about the need for vaccination. Here in the territory, we would have seen the spike a couple months ago where we went up to more than 1,600 positive cases at one time. We would have seen an increase of persons coming forward and being vaccinated. But according to the minister, ever since that period and the territory returned to some form of normalcy, obviously within the COVID era, that number had significantly declined in terms of persons going forward to become vaccinated. Can you speak to what can be done to further encourage persons to come forward and get vaccinated, despite the fact that there are so few positive cases right now in the territory?
Absolutely. So I think what I'd perhaps like to do is to repeat the message that I gave in this very studio last time I was here, which actually was around the peak, the spike of that horrible outbreak that we had here in Tortola in particular, but across all the Virgin Islands. And that is that we need people to understand that there are only two ways in which you can get immunity from this horrible virus and this horrible disease. The first of those is by being vaccinated, and the second of those is by being exposed to the virus and potentially contracting the disease. That is a very high risk strategy. Around the world, somewhere between 1% and 2%, so that's between 1 and 2 of every 100 people that get COVID die. That is not a strategy that we want to pursue. We need to make sure that if we have got a way of protecting people from serious disease, then we absolutely need to offer that to as many people as possible. So my really, really strong message to everybody across the Virgin Islands, I'm going to use your own message. Please don't procrastinate. Vaccinate for the benefit of yourselves, your family and friends, your workplace colleagues, and the entire population of the Virgin Islands.
And any upcoming initiatives that you guys can speak on that have not been announced to the public yet, that you're presently working on?
No, I mean, I think we've talked about the main initiatives that we're actively working on at the moment, which are specifically vaccinating 12 to 17-year-olds, offering the booster vaccination to anybody who will be 6 months or more since they had their second dose. And then beyond that, also making sure that there is enough vaccine here so that anybody who hasn't yet been vaccinated, hasn't yet had their first 2 doses, that is available for them should they choose to be vaccinated.
If I can just add, am I allowed to add to that? I think one key thing as well to add in terms of why people should get vaccinated is actually, yes, particularly if you're in a young age group, you may think that the virus doesn't present a huge amount of risk to you personally. And the younger you are, the truer that is, although you can still become extremely unwell. But I think the key thing is, if you are young, think about the people that you live with in your household, older members of your family, people that you come across on a regular basis. And actually, by having the vaccine, what you're really doing is protecting them and protecting the rest of your community. So I think that has to be a real focus if you're questioning why should I have it personally.
Okay, well, viewers, you heard it from the UK health experts. Professor Ian Cumming, who's the UK Ambassador for Health to the Overseas Territories, and Dr. Natalie Wright, Health Protection Lead and Consultant in Global Public Health from the UK Health Security Agency. I want to thank both of you guys for taking the time out of your busy schedule to join us here.
Thank you.
Thank you very much.
Well, good evening, viewers. There you heard it. Thank you for joining us, and I really do hope that you take what was said into consideration, and you use your due diligence basically to get vaccinated, despite the fact that we no longer have that many cases here. I'm Kamal Haynes. Thank you for joining us.